Hi everyone, I'm Mary Felling, physical therapist. Welcome to today's video. I'm going to be taking you through a follow along for treating the sacrum. The sacrum is the name of the bone at the base of the spinal column, so it looks like an upside down triangle. So here's the spinal column, and right at the base of it is the sacrum. And the pointed end of the sacrum is right at where the tailbone, also known as the coccyx, is attached. This sacral bone in our lifetime gets a lot of trauma on it. If we fall on our hips or our back when we're ice skating, or we happen to fall for other reasons, it can eventually create torque and torsion in that sacral bone alignment, and then that creates myofascial restrictions which pull into the hips, the low back, creating pain and dysfunction. So this is a really good technique for those of you who have ongoing stiffness and pain, maybe in sitting or in other positions through your low back and down into your tailbone area. So let's get started. For today's technique, you're going to need several things. One is you need a flat surface. I do not recommend a sofa or a bed because they're a little too squishy, but if you have a treatment table like I do, if you have a soft, thick carpet you can lie on, or a thick, soft exercise mat, those are probably your best bets. If you only have a floor, then I would suggest you use a ball that's very squishy as opposed to a ball that has some firmness to it. Your other option is just to take a cloth. I've got a washcloth here, and it's just knotted very loosely because we're going to be lying on these on our sacrum. So if you need to go find those tools right now, pause the video and then come back and join us. For the rest of you, if you're ready to go, come along and follow with me. So you're going to be lying down. Get a pillow for yourself so you're comfortable. You're going to lie down on your side. And you're going to take whichever tool. For me, I am a little sore in my tailbone. I have fallen many times ice skating, being a gymnast growing up. Got a lot of trauma back there, so I already know I'm kind of tender. So I'm going to be using a very squishy ball. And all you do is you're going to lift up, and you're going to go in the very low back. It's down below where your hip bones come across your body. Go a little bit lower. It's almost across from your pubic symphysis, that hard bone, very deep and low underneath your abdomen. And once you're on that, you very slowly relax. If you feel your back arching and the ball is pushing you into an arch, you're too high. Go lower than that. It's lower than you think. Once you're on that, get your feet apart so you have a nice balance and you're ready to go. So we're going to go ahead and set our timer for 5 minutes. And if you're somebody who really has a hard, what we call lumbar lordosis, that means you're really curved like this, you might even have to go a little bit lower to help get your low back flattened out a little so that it's not strained in this position. You'll still be on the sacrum, but you'll be on the lower end of the sacrum. All right, so now in this position, as we're lying here, we're doing a minimum of 5 minutes. So in the John Barnes myofascial release approach, we are using a compression or a twist, a rotation, or an elongation for a minimum of 5 minutes to help start this thing called the piezoelectric effect. The piezoelectric effect is basically a bioelectric flow. And once there's been 5 minutes of a mechanical energy placed in the body, it elicits this bioelectric flow. Well, this electric flow moves along the fascia, and when it comes to areas where the fascia has been bound down, is dehydrated, and has become sticky and glued down, called a myofascial restriction, it helps that area of the fascia to rehydrate, helps it to elongate and soften again. And when that happens, mobility, flexibility returns, and less pain in that area is felt. So, when you're doing this, that 5 minutes, so remember I was saying it's a minimum of 5 minutes, That is your minimum. I highly recommend 7, 8, 9 minutes. Because once that flow starts, you want to stay in that flow so that you can get more and more releases. Release can feel like a lot of different things. Sometimes you feel something soften. You might feel less pain. You might feel a sense, just an overall sense in your being of well-being. A release can also feel like warmth coming into the area. Or you might have a little emotion come up, which is wonderful. That's a good deep release. And we all need to get as much of the old stuff that's been hanging around inside our tissues all our lives. We need to move that out. Doesn't belong there. Just got trapped. And as you're here, some of you might feel some radiating symptoms, maybe going out to your hip, maybe going up your back, maybe even down your legs. You may be here and thinking, I feel something in my jaw. Yes, because that fascia is one uninterrupted piece of material in the body. It surrounds, it supports, and it infuses everything in our body, our bones, our muscles, ligaments, tendons, nerves, blood vessels, the brain stem, the brain, the spinal cord. Everything has a sinewy cobweb through it and around it, supporting it, giving it form. So back to the 5 minutes. So I was saying, you want a minimum of 5 minutes. Really, I encourage that 7 to 8 minute plus so you can get more and more releases. But one of the things that's been found recently in research is that at 8 minutes, not only has the fascia been released since 3 to 5 minutes, but at 8 minutes, a natural anti-inflammatory in the body is released. It's called interleukin 8. So now, not only are you getting fascia releasing and softening and undoing its compression around those pain-sensitive muscle fibers, but now you've got an anti-inflammatory in there, and that's an anti-inflammation is what causes pain. So this interleukin 8 is also helping to relieve pain. It's a twofer, it's a bonus. And some people worry, oh, what if I'm on the wrong spot? Then you're doing myofascial release on another area of the body that may very well need some work. And there's no negative side effects. The worst thing is you get passive range of motion. We all need that. All right, so very slowly, we're coming up at our 5 minutes. You can roll off, lift up, come down. And then when you sit back up, notice what has changed. So when you get up, walk around a little bit, do something that you know that usually brings the pain on and see if it's better. As always, you would continue doing this daily for 14 days. Then after that, then you can back off to maybe a few times a week to maintain any positive improvements. All right, everyone, thanks for joining me today. I invite you to subscribe to my channel so you can get the latest videos as they're uploaded to continue taking care of yourselves at home. I'll see you in our next video.